Hi all, I'm Bincy here. Today I'm back with medical surgical nursing, genitourinary system. So today we are going to discuss about renal failure. When I say failure, that means something is not working, or renal failure, renal kidney, right? So kidney is not working. Okay, kidney is not doing its function properly. That is kidney failure or renal failure. Okay, insufficiency or function. The kidney is not able to maintain its function properly. Okay, now there are two types of renal failure, that is acute renal failure and chronic renal failure. So in this video we will be discussing about acute renal failure. When I say acute, that means the severity is very low considering to the chronic. Okay, so acute renal failure will be a sudden decrease in GFR. Okay, and there will be an increase in BUN, blood urea nitrogen, sodium retention, oliguria, then hyperkalemia, then increased creatinine and azotemia. These all are the signs and symptoms when this occurs suddenly. That means the kidney is getting damaged very soon. Damage started, but it will take some more time. Acute can be treated at least 3 to 12 months. If we treat, some of the neurons get to get properly worked or get back to the normal stage also. Okay, so once again I'll tell a definition. Acute renal failure is a sudden decrease in the renal function, which such as decreased GFR, increased BUN, oliguria, azotemia, sodium retention. Okay, then hyperkalemia, azotemia. Okay, this was all about the definition. Moving on to the etiology, what can cause acute renal failure. The etiology can be divided into three. Okay, that is pre-renal failure, post-renal failure, and intra-renal failure. When I say pre, intra, and post, you will be knowing that pre means before renal failure, what and all signs and symptoms will be there. Intra means while the kidney is getting damaged, what are the signs and symptoms at that particular time. Okay, post-renal failure means the renal failure has already occurred. After that, what and all symptoms will be there. Fine. So in pre-renal failure, symptoms will be decreased GFR will be there definitely. Dehydration will be there due to any vomiting, bleeding, higher. Okay, dehydration will be there, and decreased cardiac output will be there. Because once, see, all the our organs are connected. Okay, so once kidney is getting overloaded, heart will not be able to work, even lung will not be able to work, even liver will not be able to work. Okay, so in decreased cardiac output will be there. Myocardial infarction, it is a condition, I think so, in cardiac system we will be learning it. Okay, if you have any doubt in that, please get back to me. I'll tell you what is myocardial infarction. Then congestive cardiac failure and angina pectoris. Angina pectoris is also a condition in the cardiac, okay, where the heart will not be able to do its function. There will be a pain. That pain is mentioned as angina pectoris, like strangling feeling in the chest. Okay, strangling means you what to say, you dry your clothes, right? Once you washed, you do it like this, like that strangling pain will be there in the person's chest. That was a condition which was angina pectoris. I'm moving on from the genital system to cardiac. Okay, so congestive cardiac failure will be there. Okay, then acute pulmonary embolism will be there, liver failure. This all are means one or the other organs get damaged. That was about pre-phase. Okay, in intra-phase, what happens is renal ischemia will be there. Ischemia means lack of oxygen in the blood. Then blood clot will be there, and other blood disorders such as glomerulonephritis, pyelonephritis, which all we have discussed earlier. If you have any doubt, please go back to the video and watch it. Okay, then any overuse of NSAIDs, okay, exposure to uremia condition we had discussed last session, right? Then that was all about intraphase. In post, what and all occurs, means post renal failure, what and all the signs, what and all are the etiology, not signs and symptoms, etiology, like kidney stone, bladder cancer, urinary tract organ cancer, okay, neurological disorder, which we already discussed. Then what are the risk factors that can cause acute renal failure? Advanced age, diabetic, hypertensive, okay, then heart failure, okay, then we can say liver disease such as cirrhosis of liver, for example, I said. Okay, then what are the pathophysiology? Moving on to the pathophysiology is very simple. We have already discussed once or twice that pathophysiology, only some more points we are adding it, that's it. Okay, due to etiological factor, glomerular filtration gets, or glomerular gets increased pressure. Once increased pressure for the glomerular comes decreased GFR. When the GFR is decreased, what happens is like the body blood BP is decreased. Okay, or renal circulation is decreased. When renal circulation is decreased, BP gets decreased. Okay, this happens, renin mechanism gets started. That is, renin gets started. Renin produce angiotensin 1, angiotensin 1 to angiotensin 2 through angiotensin converting enzyme. Aldosterone produce BP. Okay, that will be coming here. Okay, after that, once BP is increased or sodium retention occurs, what happens, like edema will be there. Edema also, pitting edema and not pitting edema, we have already discussed, right? Then edema will be there. After that, complete renal function loss. Okay, that is ending up in signs and symptoms such as hyperkalemia, zootemia. Okay, sorry. Okay, all the symptoms which we are going to discuss is right now. Okay, so that was all about the pathophysiology. Pathophysiology is very simple. If you know till BP increase, renin angiotensin, that mechanism, if you know when the BP is increasing, edema will be there. From the edema, what happens is like complete kidney renal function loss. Because of that, signs and symptoms, hyperlipidemia, azotemia, oliguria. Okay, these all are the signs and symptoms. Fine. Once again, I say the pathophysiology. Due to etiological factor, glomerular pressure gets increased. Once the pressure gets increased, GFR decrease. Glomerular filtration rate get decreased. Okay, then when once it is decreased, renal circulation or BP is down. When the BP gets dropped, kidney produces renin. Then renin angiotensin mechanism gets placed there. Once the mechanism get over, BP will increase or the sodium retention will be there. Edema will be present there. Once the edema is there, total complete loss of renal function, which is ending up in signs and symptoms such as hyperlipidemia, azotemia, oliguria. Okay, moving on to the phases of acute renal failure. There are three phases. Okay, sorry, not three, four phases. That is onset, oliguria, diuresis, and recovery phase. Okay, onset means the start of, onset means something is starting, right? Start or on starting of renal failure, we can say above 50 percentage, that's starting. Okay, renal failure is starting, that is the onset phase. Okay, then oliguria we already discussed, like the urine output will be less. Once the onset start, it will end up in oliguric phase. The urine output will be decreased. Once the urine output is decreased, swelling will be occurring. Okay, that is the whole body water get accumulated, so that swellings will be there. That is ending up in diuresis phase. Okay, the third phase is diuresis, and the last phase is recovery phase. Okay, recovery phase, we can say is like once we give the treatment, the bun gets stabilized. Not eating bun is blood urea nitrogen. Bun gets stabilized. Okay, and improvement take around 3 to 12 months. Okay, then and more at that 3 to 12 months, once the body once the person is reacting to our medication, the new nephrons get functioning and it gets back to normal also. Okay, this was all about the phases. There are four phases: onset phase, oliguric phase, diuresis phase, and recovery phase. Okay, moving on to the clinical manifestation, lethargy will be there, azotemia will be there, oliguria, edema will be there, especially in the feet. Okay, anuria, then anorexia, shortness of breath because cardiac is involved, pulmonary is involved. Okay, hyperkalemia, hypermagnesemia, hyponatremia, drowsiness, headache, irritability, and later, if it is not left untreated, it can lead to coma also. Okay, moving on to the diagnostic evaluation: history collection, physical examination, blood test, increased bun. Okay, urine test, ECG. Okay, then chest x-ray, then USG can be done, CT scan can be done, kidney biopsy will be done. Okay, diagnostic manipulation, that much. Management, person is having BP, increased BP, right? Hypertension, so antihypertensive drugs will be given. Okay, diuresis, patient is having swelling, so diuretics will be given. Then antibiotics will be given for the patient. Then anticonvulsant can be given. Then all nutritional therapies like hyponatremia, sodium is decreased. Then proteinuria, so we have to give protein rich food. Okay, so all these things will be given in the nutritional therapy. Then fluid electrolyte replacement, because dehydration is one of the etiological cause that can lead to acute renal failure, right? So fluid electrolyte balance will be, replacement balance will be also done. So this was all about acute renal failure. See, renal failure has two types, that is renal, acute and chronic. Okay, so this was all only about acute renal failure. I hope you all understood. So if there is any doubt, please get back to me, and I wish everyone a good day. Thank you. Bye.